Let us now study about the ADRs that are involved in isoniazid therapy and the role of pyridoxine. So, as we all know that peripheral neuritis is one of the most common reaction involved in isoniazid therapy. So, neuropathy is more frequent in case of slow acetylators. We will study later what is slow acetylator and fast acetylators. And even in the individuals who have diabetes mellitus, poor nutrition, or anemia have this neuropathy condition. So, what is neuropathy? It is nothing but dysfunction in one or more peripheral nerves. When there is dysfunction, what happens? You start feeling numbness and weakness is the most common symptom. It is also noted that isoniazid may precipitate convulsions in patients with seizures. Optic neuritis and atrophy has occurred during this therapy with this drug. Muscle twitching, dizziness, ataxia. Ataxia is nothing but the loss of full muscle control of your body movements. And paresthesias, that is nothing but abnormal sensation. You have tingling sensation or pricking sensation, which is mainly caused due to pressure or damage of peripheral nerve. Stupor and toxic encephalopathy are considered as fatal neurotoxicity of isoniazid. A number of mental abnormalities may appear like euphoria, that is nothing but feeling of intense excitement and happy, transient impairment of memory, separation of ideas and reality, loss of self-control, and florid psychosis. Florid psychosis, you have symptoms like hallucination, delusions, you have disorganized speech, sudden onset, and usually for short duration. To know about slow acetylators and fast acetylators, we have to have a flashback of metabolism of the drug. So, as we all know that it undergoes phase 1 and phase 2 reactions. So, in phase 1 reaction, what happens? The drug has been converted into an active metabolite. So, that metabolite is converted into more polar form or water soluble form so that it can be eliminated from the body. So, this phase 2 reaction only, there is a process called as acetylation. So, the addition of the acetyl group to the chemical compound to make it more water soluble form so that it can be eliminated, that is called as acetylation. Now the people who belong to North India and West India are considered as slow acetylators, and the people who belong to this blue color group, like Central India, South India, Odisha state, it might be, or East India, Northeast India. As we have discussed, the slow acetylators, that is North India and West India, who live there, no, they are called as slow acetylators. So they mainly are at higher risk of getting neuropathy from this isoniazid therapy. These neurological manifestations and peripheral neuritis is mainly because this isoniazid is there, no, it will interfere with the production of an active coenzyme, that is pyridoxal phosphate from pyridoxine, and its increased concentration in urine. So what we do, we give a prophylactic therapy, that is pyridoxine 10 mg per day. It will prevent neurotoxicity in diabetes mellitus, chronic alcoholism people, and malnutrition, pregnant women, lactating women, HIV patients. Okay, and this isoniazid neurotoxicity can be treated by giving pyridoxine 100 mg per day. Acetyl hydrazine, which is a metabolite of isoniazid, can cause hepatic damage in case of adults. So, rapid acetylators are mainly having an higher risk of getting hepatotoxicity. As we discussed, slow acetylators have higher risk of getting neurotoxicity, and rapid acetylators have a higher risk of getting hepatotoxicity. So, the patient receiving isoniazid therapy should be monthly evaluated for the symptoms of hepatitis like anorexia, that means they have a loss of appetite, or malaise, fatigue, nausea, jaundice. So they have to be evaluated for that. So most hepatitis occurs from 4 to 8 weeks after this therapy is started. Other untoward effects mainly include rashes, fever, jaundice, peripheral neuritis. Even the hematological reactions might happen, vasculitis. Other arthritic symptoms that includes back pain, involvement of intrapharyngeal joint, arthralgia of the knee, elbow, and wrists.